you'll be the injured
Oh. I could have used you yesterday. I cut my finger really badly. It
okay.
bled for an hour and a half.
Really?
Yeah, really. And then it stuck to the Band-Aid and I was screaming and my daughter was trying to help me and it hurt so badly. So I understand, Ernius. But fingers cut. They, like, I was cutting cookies. Like I was making cookies and
Yeah, I'm just gonna show you for just a small injury, not the whole, like, just a small.
well, I wish I had seen this on Friday, because.
Yeah. All right, so don't worry, this is for calorie. Okay, should I start?
Yeah.
Good morning, everyone.
Good
morning.
Yeah. So thank you so much for you giving me this golden chance to say something about this. So my topic is about how to perform for a small basic injury safely. So before I go to my details, and I would like to ask some questions. Have you ever wondered what the correct steps are for the treating a small injury safely?
Yes.
What do you think? What is the correct steps? Do you think?
I don't know. I don't think I did it right.
Okay. What would you do if a person near you suddenly had a minor injury?
Call 999.
Thank you. Like suddenly, like until they came in?
Yeah. Cover the wound.
Bandage?
Okay.
Yeah.
Anyone else? Okay, good. So why is it important to know simple first aid procedures for everyday situation? Why do you think it's important to know? Do it like knowing the first aid for every day.
To save someone.
To save someone,
It
right.
depends how bad is it.
Thank you. That's good. All right, let's get to details. So many people might not be sure what to do, how to treat a small injury safely. Knowing a basic first aid can prevent infection and helps wound heal faster. By following a few steps, you can care for minor injury. Firstly, ensure safety and prepare, or make sure that the area is safe. So like when you are having an injured person, you should have to make sure there is nothing on your around. So before helping the injured person, make sure the area is safe for both you and them. Why is it important to make sure the area is safe? Can anyone tell me?
For contamination.
For safety.
Oh, yeah.
Safety.
For safety for the both people.
Yeah, it's important that you and the injured person don't get hurt further. Check for any hazards such as broken glass, sharp objects, or anything that could cause more harm. So you just have to check if there is anything that can cause any harms. Then wash your hands or sanitize. So I'm just gonna sanitize my hands. To reduce germs, you put like to reduce germs, and put gloves on. I have some gloves right here. Woohoo!
Well done.
All right. And then staying calm and reassuring the injured person helps keep the situation under control. So when they're injured, you just have to make sure they are calming down, because if they are just moving over or just making a movement, they can just make it hard for you either. So you just have to make sure you calm down, you're okay. So what should you do check before approaching an injured person?
Make sure
check.
he's okay.
Check the breathing.
Okay,
Yeah.
so you just check the hazard first. You just check around if there's any broken glass or any sharp objects. All right, and the second step, before I go, I'll put the blood on his hand. Maybe here. You're okay. All right. So this is the injured person. So use a clean cloth or gauze or paper towel to apply firm pressure directly on the wound to stop or slow down the bleeding. So if there is an injured part, you make sure you just put a gloves on it to make sure it's to stop the bleeding or to slow down. Why is it important to apply firm pressure on the wound?
To stop the bleeding.
Thank you so much. Yes, or to slow down. Don't forget to keep steady pressure for several minutes. without a close on the top, rather than removing the first one. So you just make sure you press it for several minutes without taking it out. If it's getting more, you add on it, okay? So what should you do if the clothes becomes skidding with the blood? You add more without, don't remove the first one, okay? If you do, it will just flow up more blood. All right. Next, clean the wound thoroughly. Once the bleeding has mostly stopped, because I have pressed it for a while, so it must be just stopped or dry a little bit. Once it gets bleeding has mostly stopped, release the wound gently under clean running water for 20 to 60 seconds. So I'm just gonna use this wiper. It's sorry, I have to change this one. So this is just a wipe. So I'll use this one. So you make sure you just clean up thoroughly over the wound. So you just make sure you clean up like this. Only need a lot. I'll let more. Are you following me?
Yeah.
Don't be scared.
Yeah, don't be scared. Yeah, it's just.
So yeah, you wipe everything thoroughly here. You can't just clean up everything, just a bit. If it's blood, it will go easily, but this is not a blood, so it gets sticky under his hand. All right. So why is it important to apply? Oh, sorry. How long to release the wound? How long? 20 to 60 seconds until you just clean up everything. This removes dirty bacteria and tiny particles. Remember to avoid using strong chemicals or alcohol directly on the wound because they can irritate the skin. Do not put any alcohol or hard chemicals on it. Just wipe it over. What does releasing the wound helps remove? Okay.
Particles.
Okay, and bacteria. Okay. So yeah, it helps to remove dirty bacteria or any particles. In the fourth step, protect the wound with proper dressing. So pat the area around the wound dry with a clean gauze or a paper towel. So after you have cleaned up, I'll just put the gloves in here.
Wow. She knows. It is good. It's very professional.
Sorry, Abby.
You can do it, I mean.
All right. So what is the proper dressing in the first aid care? Gauze or bandage or something. So apply a thin layer of antibiotic ointment if available and cover the wound with a clean bandage or dressing. So you can apply, this is the antibiotic ointment, so you can apply on it if you don't have, it's okay. You just apply on it if available. So we can apply on it. Do you want me to show you?
Sure.
Yeah, I'm sorry, I just forgot to put it in.
What brand do you have? What brand of ointment?
This one?
Yeah. Is it Polysporin?
Just, I don't know, did you say the brand? The Equipment, I think.
Oh, it's like
Yeah.
Equate. Yeah.
Equate. So you just put a bit on it, like this. Like, and then you put it on the back. I'll use another one. Because that helps it to get not infected.
She's very good. She's very good.
Okay. All right. And then we're gonna put a bandage on it after you have put this one, not directly this one, because it will make it sticky. And then keeping the wound cover helps protect the firm, direct, and infection while allowing it to heal. So you put a bandage on it. You make sure you just follow up the steps because for not getting the infection.
Have you worked in first aid before?
No.
Seems pretty good.
All right, if this is not getting sticky, I have this. You don't put any, I'll show you not to use that. What is it? This one, please do not use this one. Because sometimes, especially when they're a kid, it may just, when they moved on or something, they may get it stick into their body. So you can use this tape or something like that. All right, why should you cover the wound?
Protect.
Yes.
Protect from germs.
Okay. Yeah.
To keep clean.
Yes, it helps you heal faster. When you just put a bandage on it, it's not getting any infection, so it helps it to get good. In the fifth step, pain and observation. Watch for any change. Observe the injured person for any change in pain, swelling, redness, or unusual dressing. So you just make sure you follow up what you are having. So what signs might show the wound is infected?
Pain,
Okay. Anyone else?
redness.
Swollen.
Redness.
Yeah. Swollen, redness, or unusual discharge.
Sometimes if there's a line, a red line, that's infection.
Yeah.
So watch for
The
that.
redness, like it gets red more
But
here.
also a line.
A line up right
Yeah.
through your muscles,
Yeah.
yes. In addition, encourage them to rest their injured area and avoid touching or scratching the wound. So please do not touch it or make sure you don't do anything with this hand, okay? So you have a rest with it. And do not scratch it, please. I know it will get itchy, but do not. So watch for any change. Watching for changes help you identify early sign of infection. Why should you observe the wound every day?
Why?
Why should you observe every day? Like,
Infection.
yeah, maintaining the wound helps you notice early sign of infection. Finally, follow up and when seek help, get help if needed. So continue to check the wound daily and changing the bandage whenever it becomes wet or dirty. You can change it when it becomes wet, or you make sure you have extra of this one. So you can change all the bandage daily when it becomes wet or dirty, sorry. When should you change the bandage?
When it's
When
wet
wet.
or
When it's wet or
dirty.
Thank you. Yes. If the wound becomes more painful, swollen, redness, or begin to smell, it may be a sign of infection, and medical help should be sought. So it becomes to smell or see any redness or painful, that maybe need more medical helps. So getting assistance when needed. Ensure the injured person heals safely. What do you do if the wound gets worse?
Go to the doctor.
Doctor?
Thank you. Yeah, if it becomes more painful, redness or swollen, or starts to begins to smell, you should get a medical help. In conclusion, by following this step carefully, you can safely treat a minor injury and reduce the risk of any complication. Suggestion: if you don't monitor the wound attentively or take an action when it becomes more painful, swollen, or show any indication of infection, the condition may deteriorate significantly. Therefore, I highly recommend adhering to each step with care and seeking prompt medical attention should any concerning changes arise. And I also highly recommend everyone should have this first aid box at home, and then you can easily instruct yourself. Thank you so much.
Are you okay? Well done, okay, very good. Wow, okay, well, we're gonna finish early, but I wanna talk to a few people, so let me